Everyone experiences an upset stomach once in a while, but what if that pain is all the time?
So IBS, or irritable bowel syndrome, is a very common condition. It probably affects about 20% of the US population, and it's probably the most common complaint that we see in the outpatient GI clinic.
How do you know that it's a chronic condition like IBS?
Patients, when they do have IBS or irritable bowel syndrome, experience abdominal pain as well as changes in their bowel habits, be it either constipation or diarrhea, or sometimes patients may experience a combination of both.
Although the exact causes are not known, doctors have some theories.
So we don't really know what causes IBS, but there are several theories that are out there. So one of the theories includes the state of visceral hyperalgesia, in which patients have a hypersensitivity to what we would term normal bowel movements or normal amounts of gas.
If you start to experience any symptoms on a regular basis, it's important to see a doctor because the symptoms can mirror other chronic conditions like lactose or gluten intolerance. Doctors say it is important to rule out a food sensitivity. That can be done with a blood test. It's also crucial to rule out a more serious issue like ulcerative colitis, gallstones, or even bowel cancer. Doctors say there might even be a connection between the gut and the brain.
So with IBS, patients who have underlying stress and anxiety appear to be a little bit higher risk for irritable bowel syndrome. So there is a thought that when we're under heightened states of stress, that our gut may be more sensitive to certain stimuli. So that's where the term brain-gut axis comes from.
So what can you do if you suspect you suffer from IBS?
So one of the first things I tell patients to do is to keep a daily diary. So on that diary, keep a log of what they're eating, what their symptoms are, meaning abdominal pain, how many bowel movements they're having. Oftentimes patients, once they keep a diary, they can often find a pattern to their symptoms, and maybe simple avoidance of certain foods such as dairy products, legumes, and cruciferous vegetables such as broccoli and cauliflower can help to combat their symptoms. Other things that can help IBS include increasing amounts of fiber. So it's unusual for the normal American person to get the right amount of fiber because we need about 25 to 35 grams of fiber in our diet.
Exercising is also crucial for people with IBS, and if needed, there are medications to help ease the pain. Holly Fur for CNN, Atlanta.